So, you're stuck on the toilet and you're out of this toilet paper. You cry for help, but no one can because there's absolutely no toilet tissue left in your house nor at the store. Running out of toilet paper has happened to most of us, but we've always had a reserve supply that comes to our aid in our desperate hour of need. Now we don't though. Why? The coronavirus. There's not any left at all even to buy off the shelves at Walmart, Target, Sam's, or even the Dollar General. Why is this? It's widespread panic. People are panic buying. Panic buying stuff like toilet paper, food, sanitation supplies, medical masks, etc. The coronavirus has caused massive, unnecessary panic, and it's spreading rapidly. It's funny to think about running out of toilet paper of all things. However, there is a serious shortage of medical supplies due to the current illness. Casual civilians have run to buy masking gloves, leaving the healthcare professionals with a dwindling amount of supplies. I believe the panic and mass hysteria surrounding COVID-19, the illness caused by the coronavirus, does more harm than good. This is a model of the coronavirus and what medical professionals say it looks like. It's encapsulated like the Ebola virus was, and that's what makes it harder to kill. The coronavirus has affected our daily lives to its fullest extent. According to cdc.gov, we are supposed to be social distancing and only going out in public when it is absolutely necessary. The total cases in the U.S. has risen to 15,219 domestically. There have been 201 deaths linked to the COVID-19 nationally. WHO says the worldwide death rate is 4.2%, according to their website. The uncertainty surrounding the virus has caused alarm and panic, but we shouldn't do these things. Our panic and harm has only resulted in the mass consumption of goods and products that others desperately need. No, I'm not talking about just toilet paper. I'm talking about medical supplies and sanitation necessities for hospitals and the elderly. Hand sanitizer is currently at such a high demand that not even hospitals or pharmacies can get either of the two. I work at a pharmacy and I know about this from a first-hand experience. Medical masks are being selfishly taken by people who aren't even going into public, resulting in a shortage for the healthcare workers battling on the front lines. This is a serious issue and it needs to be resolved. So how do we resolve it? Just don't panic. Listen to our world health leaders. Adhere to the CDC guidelines. Take into account the words of the World Health Organization. Abide by the policies announced by President Trump and his White House staff. Panicking does no good, and it only induces more fear and over-exaggeration of the virus. This is the current map of the virus and its spread. China is leading, as where it originated in Wuhan. Italy is following close. India is following, also currently really close to China's numbers. Everybody else is slowly accumulating more cases each and every day, but that's due to new distributing of testing kits. The virus itself seems to be more deadly than the media make it out to be in the first place. According to COVID-19, an article published in an international medical journal, the death rate is overinflated due to an unprecedented amount of the undiagnosed cases due to lack of testing. In the United States, the cases are just now rising because we are currently just now getting test kits from the CDC. The reason the death rate is so high is because we don't have enough medical supplies to test people throughout the world. Healthy young people are not dying at mass rates though, proving that this is not a super virus that many make it out to be. Another medical journal by Fang Jiang reviews the coronavirus and says that what we are doing should slow the spread slowly and make the curve of the bell of cases go under how many people can be supported in the ICU units in hospitals. The closing of public schools and universities, public restaurants, and all other non-essential businesses will lead to a reduction of the amount of new cases each day. There's also a vaccine in development, and this should be good news to all of us. Soon we'll all be able to be immune to this certain strand, and from there we can go on to exploring new strands of the virus and combating it with medical knowledge. There's also clinical testing of the vaccine according to a rapid response to an urgent need. This is also a medical journal entry. The vaccine has become the fastest to ever enter clinical testing in the history of medicine, and is showing promise. The panic throughout the world only leads to panic buying and a shortage of necessary supplies for people who actually need it. What happens if we keep panicking? It'll lead to mass hysteria and global disaster economically. The stock market keeps dropping, and it's lost all of its earnings since President Trump took over office. Do we really want another depression or recession again? I don't. We would also continue to hurt the people who need the supplies desperately. If people continue to buy masks and waste them by not wearing them or going out in public with them on, then the people on the front lines or even the elderly could end up dying from COVID-19. Panic only hurts everyone instead of helping anyone. So what's the solution? Stay home, wash your hands, and social distance. This is what the CDC has recommended. We need to remain calm, listen to the experts and what they are saying, and we need to take their recommendations into our minds and use them and practice them. Remain patient, and we will all get through this together.